Bismillahirrahmanirrahim. Dear students, today, inshallah, we are going to talk about mechanisms and pharmacological actions of muscarinic and nicotinic agonists. Previously, we talked about the direct acting and indirect acting parasympathomimetics. Today, we're going to get into more details about the direct acting parasympathomimetics, which are the agents that directly activate muscarinic and nicotinic receptors. Okay. The laws, the student should be able to understand the mechanisms and pharmacological actions of muscarinic as well as the nicotinic agonists. So the first drug we should talk about is the parent drug for all the parasympathetic nervous system, which is acetylcholine. We talked before about it in details, but today we are going to talk about its effects on the parasympathetic nervous system, autonomic nervous system generally, and CNS. As you know, it activates both muscarinic and nicotinic receptors. Actually, these receptors, the names of these receptors have been named cholinergic receptors because they respond to their ligand, which is acetylcholine. So acetylcholine functions both in the central nervous system and peripheral nervous system, okay, as a neuromodulator and at autonomic and somatic sites. Okay, so both in the somatic nervous system and in the autonomic nervous system. Here is the structure of nicotine. I'm not expecting you to memorize all of these carbon, oxygen, double bond, whatever. No, I'd like to focus on this group here, this amine group. Okay, this is tertiary or quaternary amine. It's quaternary. Just count how many bonds are around the nitrogen atom. 1, 2, 3, 4. If there are 4, it is quaternary. There is extra because nitrogen, if there is only 3, there will be no charge. Okay. Okay, doctor, this is not a chemistry class, it's pharmacology, right? Yes, I know, but please pay attention to that part. It's very important from the pharmacological point of view. If the drug have this charge, it is lipophobic. It's insoluble in lipids. Okay, so if it's insoluble in lipids or it's lipophobic, if it's lipophobic, means that it does not cross any lipid membranes, right? So, for example, blood-brain barrier cannot cross the blood-brain barrier, conjunctival membrane, right? Placenta, any cell membrane, right? The cell membrane is lipid cell membrane. So this is very important. However, if it is tertiary, this will help. I cannot say for sure because we need other things. Will help the drug to pass through the blood-brain barrier, conjunctival membranes, and so forth. Okay, in the CNS and in the CNS, acetylcholine and its neurons form what's called the cholinergic system, which tend to have excitatory actions. Okay. However, acetylcholine, if it's injected intravenously, what happens? Number one, it will not pass the blood-brain barrier, right? Okay, because why, doctor? Again, okay, just remember this group here, the quaternary ammonium group, right? So this makes the compound charged. Charged means it is hydrophobic, it is lipophobic, it cannot pass through the lipid membranes, generally speaking, and one of them is the blood-brain barrier. And thus it has no central effects, okay? However, if you inject it into the brain directly, it will cause stimulation followed by depression. Okay, in the peripheral nervous system, when you talk about peripheral nervous system, if you remember this division, so I'm talking about the autonomic nervous system and the somatic nervous system. Okay, somatic, when you talk about skeletal muscles, so and the voluntary part of the nervous system. So it activates the skeletal muscle, somatic, right, and is a major neurotransmitter in the autonomic nervous system. Of course, we know that activates again both muscarinic and nicotinic receptors. Many students get confused when you say acetylcholine activates muscarinics only, or muscarinic receptors only, or nicotinic receptors only. It's both. It's very easy question. Okay. However, it's rarely used clinically because so many issues. Number one, if you use it orally, it's going to be digested in the GIT. If you use it intravenously or whatever, okay. If you remember, we have these two enzymes, the cholinesterase and pseudocholinesterase, or butyrylcholinesterase. Butyrylcholinesterase or pseudocholinesterase will hydrolyze acetylcholine in the blood mainly, and cholinesterase enzyme will hydrolyze acetylcholine in the nerve terminals. So anyway, it's going to be hydrolyzed anyway. So you cannot use acetylcholine itself as a drug. That's why many muscarinic agonists with resistance to hydrolysis, so to address the issue number one in the GIT and also in the blood and nerve terminals, these drugs have been developed, including carbachol, methacholine, betanicol. We talked about this before. We said these choline are choline esters. So remember this root col. These are choline esters. They are resistant to hydrolysis. Okay. In addition, there are alkaloids that also have muscarinic agonist effects, such as pilocarpine and muscarine. Okay. And the use of these muscarinic receptor agonists is contraindicated in patients with asthma, coronary insufficiency, peptic ulcer, and incontinence. Why? Again and again and again, please, the table at the end of the previous lecture is very, very, very important. It includes all the parasympathetic nervous system effects on different organs. So if we talk about the bronchi, the parasympathetic nervous system cause bronchoconstriction and increase bronchial secretion. Coronary insufficiency, it causes mild narrowing or constriction of the coronary blood vessels. On the level of peptic ulcer, if you remember, on the GIT, we say it causes enhance the peristaltic movement and increase the gastric secretion, so it's contraindicated in peptic ulcer. And urinary incontinence, again, activation of the wall or stimulation of the walls and relaxation of sphincters will worsen the urinary incontinence. Okay. So let us now we talked about the parent drug, the acetylcholine, that activates both muscarinic and nicotinic receptors. Okay, let us talk globally about muscarinic agonists. Okay, number one, of course, acetylcholine activates both muscarinic and nicotinic. Carbachol also. We have the remaining drug, methacholine, muscarine, pilocarpine, oxytolmorine, all are selective muscarinic agonists, and most of them are resistant to hydrolysis by acetylcholinesterase, except methacholine and acetylcholine. Okay. Methanicol could be used for bladder hypotonia, okay, because again it activates stimulate the bladder wall and relax the sphincter, okay, and GIT activates the GIT wall, the peristaltic movement, and relax the sphincter. Okay. One thing to note here, very important thing here, look at these groups here. Again, I'm not talking chemistry or whatever. Yeah, here I'm pharmacologist. I remember, don't worry. So it's again just to pay attention to the nitrogen atom. How many groups are around the nitrogen atom? 1, 2, 3, 4. 1, 2, 3, 4. So these these amino groups are called quaternary ammonium groups. Quaternary ammonium, they have positive charge. They have positive charge again. They are lipophobic. They cannot pass through the lipid cell membranes. They cannot pass through blood-brain barrier, conjunctival membranes, and many others. Okay. However, here we have tertiary amine. So here, look at the nitrogen surrounded by 1, 2, 3. Nitrogen 1, 2, 3. This tertiary part, okay, this is lipophilic. Okay, because there is no charge. It's easy, guys. Just the lipids They are CH3, CH2, 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 whatever, right? In addition to the glycerol, of course, and ester. Okay, so mostly they are carbon, hydrogen, carbon, hydrogen. They don't have charge. And in solubility, when we talk about solubility, we say this proverb: like, likes, like. Again, like, likes, like. So if you are lipophilic, you mix with lipophilic, you are okay, you are happy with each other. If lipophilic mix with lipophobic, they hate each other. If you put a drop of oil in a glass of water, the drop of oil will take itself, aside, say, yeah, I don't like you. I just, I don't like. If another drop of oil goes inside this same glass of water, it will go to the drop of oil. They said, oh, finally, I found a friend, but I still hate you, the water molecules. Okay, so this is the basic and very easy principle. So if the compound has a charge, it means it's not easy for the compound or the drug to pass through lipid membrane, to pass through blood-brain barrier, conjunctival membrane, whatever. Okay. Sorry. Okay, I think these are the most important parts here. Okay, so now the only two drugs we're going to talk about is just beta-nicotinic. We just only talk about the use and muscarinic, selective muscarinic agonist. We need to talk about the most important drug among these two is the pilocarpine, because main use is in glaucoma. So again, stimulate muscarinic receptors with an effect on nicotinic receptors. Again, look at the structure. Again, it is tertiary, so it can pass through cell membranes and through, through lipid membrane, generally speaking, blood-brain barrier and conjunctival membrane. It's not hydrolyzed by cholesterol, as we mentioned, just in a minute, for a long duration of action. Okay, it's most commonly used then beta-nicotinic to induce salivation. Okay, it's one of the effects of the muscarinic agonist, right, for parasympathetic nervous system, and for various purposes in ophthalmology. So treatment of symptoms of dry mouth for whatever reason. The most important one is treatment of primary open-angle glaucoma. So glaucoma, generally speaking, is a disease of the eye, okay, due to the increased intraocular pressure, which can eventually damage the optic nerve and can cause blindness. Okay. So before we talk about that, why, from where comes this intraocular pressure? The eye has to be a little bit distended, right? So for the eye to be distended, there's this liquid called aqueous humor. Aqueous humor supplies these avascular tissues such as uvea, lens, okay, with nutrients and takes away waste products. It's kind of acting like completing the action of the blood. Okay, it's secreted by the ciliary body, then moves around the iris, constrictor pupillary muscle, dilator pupillary muscle, until it goes, the drainage of this aqueous humor will go through the canal of Schlemm. Okay, so this is the normal pathway. If you move the iris, okay, this way, okay, I mean, laterally, this will impede the passage of the aqueous humor. Okay, which muscle does that? Look at here, it's easy here. Dilator pupillary muscle will relax the iris, so it will go this way. Okay, if it relaxed, go this way, so it will impede the passage of aqueous humor. So it will increase the activation of the dilator pupillary muscle by what? By the sympathetic nervous system will relax the will move relax the iris and will move the iris laterally to impede the passage of the canal, the aqueous humor through the canal of Schlemm. However, activation of the constrictor pupillary muscle by what? By parasympathomimetic, yes, or parasympathomimetic drugs, will pull the iris this way medially, okay, and then kind of move the iris a little bit out of the way of the passage of the aqueous humor. So aqueous humor is no longer impeded and can pass through the canal of Schlemm easily. So the take-home message of this part, okay, is parasympathomimetics, if they can pass through the conjunctival membrane, they are good. They are good treatment for, generally speaking, of course, for glaucoma. Sympathomimetics, the opposite. right? Because they will activate the dilator pupillary muscle, which will relax the iris and impede the passage of aqueous fluid. However, sympatholytics are important in treatment of glaucoma. That's why you have, for the sympatholytic, you have like timolol eye drops, and for the parasympathomimetics, you have, this is sympatholytic timolol, beta blocker, and for the parasympathomimetics, the most common one is pilocarpine. I hope this, gives you like a good brief about this, okay, this part. So now we understand why parasympathomimetics like pilocarpine, okay, because it can pass through the conjunctival membrane, and it's tertiary, because it's tertiary, I mean, it's effective in treatment of glaucoma as eye drops. I think that's it now for the glaucoma. Okay, so the adverse effect of this is just related to its parasympathomimetic effect. And if you remember from the previous table that have M1, 2, 3, 4, and 5 receptors, it's non-selective agonist. Can activate all the M receptors, M1, 2, 3, 4, and 5. So you can expect all the effect of parasympathomimetics like excessive sweating, salivation, bronchospasm because it can cause bronchoconstriction and increase bronchial secretion. Bradycardia cause decrease heart rate, and hypotension cause dilatation of blood vessels. Remember, through the nitric oxide pathway. Remember, good. And it can cause enhance the peristaltic movement and cause relaxation of sphincters, can cause nausea and diarrhea, and it can cause meiosis because it constricts the dilator pupillary muscle. So now for the nicotinic agonists. Nicotinic agonists. Nicotine is the most commonly encountered nicotinic agonist. Why? Why? Yes, because it is the major component and the most important component in cigarette. Okay, this is nicotine. Okay, it's tertiary amine. Yes, tertiary amine, nitrogen, and surrounded by 1, 2, 3. Even if you look at this one, 1, 2, 3. So 3 bonds. So it's tertiary. It is lipophilic. It's soluble in lipids. Okay. It's sufficiently soluble to be absorbed even across the skin. So if you are sitting next to someone who is smoking, you can not only inhale the tobacco smoke, but also you can this nicotine could be absorbed through your skin. It's responsible for the addicting properties of the tobacco smoking. It has greater, even though it's nicotinic agonist, we can expect it's nicotinic agonist. It should activate both, right? Nicotinic receptors and nicotinic NN and NM receptors, NN in the ganglia and NM in the skeletal muscle. But for structure, it's more selective for the NN receptors in the ganglia. Nicotinic actions, generally speaking, are complex moves from stimulation until depression at the end. Okay, so at low dosage, it stimulates NN receptors, that's beloved subtype of nicotinic receptors, and initiate action potential. Why it initiates action potential? Again, please remember, we said nicotinic receptors are ligand-gated ion channels. Ligand-gated ion channels mean upon the binding of the ligand, which is acetylcholine or nicotine, any cholinomimetic will bind to the nicotinic receptor on the sodium channel. This will cause conformational change and allow the passage of sodium. Sodium, okay, will start the action potential. So action potential in the postganglionic neuron. That's why it activates both sympathetic and neurosympathetic transmission. It acts like activation of both sympathetic and parasympathetic nervous system at the same time. Okay. So now here, when we talk about ganglia, if you activate ganglia, you're activating both sympathetic and parasympathetic. In the cardiovascular system, nicotine effects are generally sympathomimetic, okay, on blood vessels, so they can cause vasoconstriction, and parasympathomimetic on the heart can cause some bradycardia. In the GIT and urinary tract, the effects are mostly parasympathomimetic, so it can cause contraction of the walls and relaxation of sphincters. Maybe this is responsible for the fact that the smoking guy will go to the toilet more frequently than non-smoker. So now all these at low dosage. If you increase the dose, there is stimulation of nicotinic receptors everywhere. If you increase the dose much more, it has some antagonist effect at nicotinic receptors. Agonist, antagonist, agonist, antagonist. Why? Because again, it's ligand-gated ion channel. Nicotinic receptor, okay, is ligand-gated ion channel, so it will allow the passage of sodium, sodium, sodium. So now we are talking about the action potential goes like that, up until the sodium channel closes. The sodium channel closes, and still nicotine is there. It's not broken down like acetylcholine. So again. So the action potential will be stuck at this level of about plus 30 or plus 35 millivolt, where the sodium channel blocks, and it will cause blockade of the ganglia. Okay, so generally speaking, please take it generally. The smart student like you will take these facts and generalize them. Any nicotinic agonist will have these effects. You will find these also on the depolarizing neuromuscular blocker, such as acetylcholine, because it's agonist on the nicotinic NM receptor. Again, it's nicotinic receptor. It is ligand-gated ion channel, same thing. It will be stimulation followed by depression. Okay. So nicotinic agonists, there is ganglion stimulants, okay, because nicotinic receptors are in the ganglia and in the motor endoplate, right? So ganglion stimulants, most nicotinic agonists affect both ganglia and motor endoplate, but nicotine affects ganglia preferentially. Again, we said it loves NM. Okay, if you need a mnemonic, okay, NN, how many N's? How many N's are here? How many N's? We have N. So NN. Okay, the muscle does it have N? No. Okay, so NN. Even if you say motor end plate, the total ends in these three words is what? How many? Motor, no N, end, one N, plate, no N, right? One N on. So NM, right? So here and here this is a good mnemonic, nicotinic. Okay, so the neuronal, okay, the neuronal has two ends. Okay, the ganglion have two ends. Okay, ganglions have two ends, right? So ganglionic is NN or neuronal. So it's called also neuronal. Okay, so NN, right? So this is good mnemonic for the NN receptor. So nicotinic, generally speaking, it means NN, NM. Okay. It goes down to NN, ganglionic, you have here 1N, 2N, right? So it is NN, right? And if you say neuronal, right? 2 N's, so NN. Okay? And motor endoplate, there is the M here, okay? And M, NM. So it affects mostly the NN because, again, nicotine, NN, okay? So they like each other. It has important effect on the brain stem and cerebral cortex. It can cause some mild alerting effects. Okay, at larger dose, may cause tremors, emesis, and can stimulate the respiratory center and can end in convulsions and may terminate in fatal coma. Yes. So if I just smoke one cigarette, can I die? No, it's in high dose. Okay, and that's why it could be used as insecticide. The lethal effect of nicotine on the CNS, and the fact it's readily absorbed from the skin form the basis for its use as insecticide. Insecticide, doctor? Yes, it's insecticide. If you don't believe me, just go and Google, write nicotine and write insecticide. You will find hundreds and thousands of results for your research. So they are not, generally speaking, ganglion stimulants. They are not used clinically, but only as experimental tool, because I can affect everything: parasympathetic nervous system, sympathetic nervous system. When you use drugs, we need to use selective drugs, selective just for sympathetic, like alpha 1, alpha 2, beta 1, beta 2, whatever, or parasympathetic M1, M2, M3, M4, or NM. Now we are activating everything, so you can expect a huge and the worst ever side effect profile. So they are not used clinically. generally speaking. And just these, we end up with these some images I downloaded for you to just, if you don't believe me that nicotine is used as insecticide, here are some of these images that prove to you that it's used as insecticide. That's it for now, and inshallah, see you next, inshallah, maybe next week in our next lecture. And please enjoy and say Assalamu alaikum wa rahmatullahi wa barakatuh.